Hi and welcome to Shape Your Life. I'm your host, Ronald Apviji, and this week we take a closer look at general health. Stay tuned to find out how prevention is better than cure when it comes to diseases of lifestyle and your quick, easy and healthy recipe coming up.
This week on Shape Your Life, we take a closer look at general health.
Lifestyle diseases such as hypertension, diabetes and cholesterol can all be prevented by taking a proactive approach when it comes to your diet and exercise. Our medical expert explains. Dr. Botha, looking after our health is a priority for everybody, but many people wait till it's too late, so they're very reactive in their response to any sign or symptoms they may be receiving. Why is it important to take a proactive step to looking after your health?
It is very important because we often find, especially in the state sector, where people postpone up to a point where they present where it's too late. They have stage 4 cancer, they have end-stage renal failure, they could have lung disease from smoking just because they were in denial for such a long time. So generally, if you have any symptom that persists for more than a month, rather seek advice earlier. It might be nothing, but it might be something significant.
Many people rely on this new doctor that's out there. It's called Dr. Google for all the information. So they log into the search engine and a billion web pages pitch up on the screen and they select which one they want to believe and follow that advice. How risky is that when it comes to our health?
It's extremely dangerous. On the one side, I find a lot of patients who become so neurotic and anxious about their own health that they keep believing they have all of these cancers just because they have a headache and it's listed as one of the causes. You have that on the one side, and then the more severe end of it is people who rather follow Google's advice for something that is serious, and they never come to see a doctor.
We know that our youth are suffering more and more at younger ages from different diseases of lifestyle, and it's associated with being inactive and obesity. What's your advice to parents to look after the health of their children?
It's a very complex question actually, because you cannot control what your child does at school, but you can at least try at home to enforce a healthy lifestyle by being a good example. So just a balanced diet and regular exercise, you can ensure that they actually do netball or they do rugby. That could contain the child. If they do start developing signs of obesity, rather go and see a dietitian earlier, because obesity has a lot of complications later on in life. They won't necessarily suffer from it in childhood or even adolescence, but later on it can cause arthritis, cancers, heart disease, stroke, and a lot more.
There's a big trend and a shift towards integrative medicine. What is that and why is it becoming such a big thing?
Well, a healthy body houses a healthy mind. That's why we always try to look at a patient biopsychosocially, meaning you have to be physically healthy to be emotionally healthy and be socially happy. It's all interlinked.
Doctor, what are the important medical numbers that every person out there should know and be aware of?
You definitely have to know your weight, you have to know your blood pressure, your blood glucose level, and cholesterol. These are very basic. You can do it at any pharmacy, any clinic, any GP. Always do it at least annually.
And that's part of the whole proactive looking after your health trend?
Definitely. If you can pick up that your blood pressure is borderline at an early stage and you start treatment, it prevents a lot of complications in the future.
Is exercise and nutrition important as your weaponry when dealing with a healthy lifestyle?
Yes, definitely. Not only does it prevent these illnesses, but it also is used in its treatment. If you have, for instance, hypertension, you have to avoid salt, you have to exercise and lose weight. Simply by those measures, you can let your blood pressure drop by 10/10 without even taking medication. And the same accounts for diabetes and insulin resistance and even cholesterol.
Doctor, what role does genes play when it comes to looking after our general health?
It's very important because most of the chronic conditions have a very strong genetic component to it. If you know, for instance, that one of your grandparents demised of cancer, you would be much more vigilant at an earlier age to start screening for these. This accounts for hypertension, diabetes, cholesterol, and all the cancers.
What is your final pearl of wisdom to our viewers out there who want to live a healthy lifestyle?
Always have a balance. Have a balance between a healthy body, a healthy mind, a healthy social support system, and if you do experience any symptoms, seek advice earlier, don't postpone.